Looks like we don't have anyone yet. Excellent. Good afternoon, everyone. We're going to get started in just a minute. Thank you all for joining us this afternoon. We are still attempting to try to get this live on Facebook, but welcome. And we're excited to have Jenn Michelle Pedini here with us today from Virginia NORML. Jenn Michelle Pedini is the Development Director of NORML, the National Organization for the Reform of Marijuana Laws, and serves as the Executive Director of the state affiliate, Virginia NORML. Jenn Michelle's work in Virginia has resulted in the implementation of a regulated medical cannabis program and the establishment of the Virginia Legislative Cannabis Caucus. VBCF worked with Jenn Michelle and NORML on the Let Doctors Decide bill in 2018, and we are so lucky to have them here to talk with us today on where access to medical cannabis stands in Virginia now. Jenn Michelle, also, just so you all know, we are going to be taking questions throughout, so feel free to enter any questions you have in the chat box. And with that, Jenn Michelle, you can share your screen whenever you're ready.
Thanks so much. Let me go ahead and get our presentation up here. All right, there we go. So welcome everyone. We're going to talk about medical cannabis in Virginia, and it's really such a timely topic for this group because we are literally just days away from the very first dispensary opening in Virginia. It's really exciting. So let me give you a quick little legislative overview. Virginia really started its exploration with medical cannabis policy way back in 1979. We were one of the very first states in the country to pass a medical cannabis related law. Unfortunately, that law uses the word prescription, so it's kind of been self-defeating ever since day one. Doctors can't prescribe marijuana in the United States. They can only recommend or issue a certification, something to that effect, but they can't legally prescribe it. Now, really nothing happens in Virginia from 1979 until 2015, except for preventing the repeal of that 1979 law. And in 2015, we here in the Commonwealth saw the same thing that we were seeing around the country, and that was fresh faces to the cannabis conversation. Instead of old white lawyers or college students, demanding freedom and justice for all, we saw moms and dads and families of predominantly children with seizure disorders asking for the allowance of the use of some type of medical cannabis. And this was a tactic that was really effective. It resonated not only with our legislature, but with conservative legislatures around the country. And we started to see really limited scopes of allowance passed that weren't really what we had been seeing when we thought of medical cannabis. We were seeing laws that we would now generally refer to as CBD specific laws passed, but needless to say, this is what happened here in Virginia. And we were happy that we were able to do anything. And so we called that a win in 2015, and we came back in 2016 and said, thank you so much, but we really can't use the public policy solution of federal interstate drug trafficking to get medical cannabis products for these patients into the state. We really need to be able to make these medicines right here in Virginia, and the legislature let us hit the ground running with that, and we came back in 2017 and passed that into law. What was only an affirmative defense for production, meaning it wasn't even legal under state law. It wasn't legal for patients, it wasn't legal for these companies, but as long as they were registered with the state, then they could have a defense in the court of law if they were, arrested or prosecuted for marijuana possession or manufacturing. Now, as was mentioned earlier, in 2018, we brought a policy to the table called Let Doctors Decide. Originally, this affirmative defense was only for patients with intractable epilepsy. And so rather than creating some special list of conditions, we convinced the legislature it would be more appropriate for healthcare practitioners to practice medicine rather than the General Assembly. So with the help of the one position in the Senate, Senator Siobhan Donovan, we were able to pass the Let Doctors Decide bill with Virginia Breast Cancer Foundation right there next to us. And it was really, you know, a huge victory. And it became a policy that was emulated around the country. This is the standard for medical cannabis laws now that states aspire to. We still see states out there trying to hang those extra conditions on the Christmas tree, but we encourage them not to, and to simply remove the legislature or whatever regulatory agency that may have in place out of the process, and then just let healthcare providers get at that practice of medicine. In 2019, we came back and again took a pretty progressive step, not just for Virginia, but for the United States as a whole, when we became the 4th state in the nation to allow registered student patients to have access to their medical cannabis on school grounds and during school events. We also launched the state's Virginia Legislative Cannabis Caucus, becoming the 2nd state cannabis caucus in the country. And that year, the state also hosted its first cannabis summit. Fast forward to 2020, here we are, and this year we were finally able to put the affirmative defense behind us. Yes, medical cannabis is now legal under state law, and we have expanded the program by allowing the existing licensees to have 5 additional dispensaries in their health service areas. So I think the main question is, look, what can we get? What can we get under this program? And this program is a little restrictive in that regard, but it's not unique. Many states have started with an extraction-based model, meaning the plants are cultivated and the essential oils are extracted from the plants, and then the products are formulated from those oils. And that's what we have here. So they will be in the form of gels, creams, lozenges, tablets, capsules, suppositories, patches, and even inhalation products. But they're not going to be in the form of botanical cannabis, flower that people generally know as marijuana. That's not available yet under this program. And there are a limited options for, well, potentially limited options for edible type products. You will be able to get lozenges and lollipops and gelatin cubes, as we call them, though most people call those gummies. But really, there's not a real likelihood at this point in time that you're going to be able to go to one of the dispensaries and get cookies, because these are regulated as pharmacies, and you and I know that you don't generally get your medicine in the form of baked goods at Virginia pharmacies. Now, these products are highly regulated. They have to undergo really, really stringent third-party analytical testing. It looks at pesticides, solvents, other organic organisms that might be in there, mold, yeast, little bugs, and really is ensuring just absolute patient safety. We want to know that what's in the bottle is what's on the label. And so we've ensured that through a legislative and regulatory process here in Virginia. Now, each one of these doses of product, because again, this is under a pharmacy model here. So a dose in Virginia under pharmacy law is a single dispensed unit. So 1 capsule, 1 gelatin cube, 1 spray, 1 tablet, right? 1 inhalation, something that you can measure as being 1. Each one of these doses must have at least 5 milligrams of cannabidiol, that's CBD, or 5 milligrams of THCA, that's tetrahydrocannabinolic acid. That's how THC is present naturally in the plant. And it's like this because when they were first drafting these regulations, we wanted to be able to ensure that there was actually an active ingredient in the product. Now, at 5 milligrams per dose, it's probably not going to be of any therapeutic value to anyone, but it is going to make sure that there is actually some cannabinoids in each dose that's being dispensed. And there is an allowance for up to 10 milligrams of THC in each dose. And this is simply based on what is the general standard throughout the country for edible products in adult use states. A single serving in an adult use state of an edible product can have up to 10 milligrams of THC. And so we applied that to our program here as well. Now, unlike with the prescription, your doctor isn't the one who's deciding what your dosage is going to be. That's going to happen at the pharmacy, at the dispensary, with the pharmacist. A patient is going to get a consultation there, and together with the pharmacist, they will be able to decide what products might be right for them and what the dosage a patient should start with might be. And there is no limit on total dosage. While there is a limit on individual dose, there isn't on doses, on total dosage. I see that we have maybe, do we have any questions yet? I see some questions popping up here in the chat.
I haven't, no questions yet. Thanks, Jenn Michelle.
All right. Well, feel free to interrupt me if there are any.
Absolutely.
So here in Virginia, we call these medical cannabis facilities pharmaceutical processors. This is scary for a lot of people because they don't want their medical cannabis made by what they think is big pharma. I can assure you that this is just weird language that our General Assembly and regulators were emotionally comfortable with back in 2016. These are medical cannabis companies. They don't have anything, they're not big pharma, they're cannabis companies. So, you know, I guess you just have to ignore the name, but that's what we call them. And these are big operations. These are what we call vertically integrated, meaning everything happens under that one license. The cultivation, the extraction of the oils, formulation of the products, the dispensing at the retail pharmacy, and the delivery of products. That is allowed under our model as well. There are currently 4 pharmaceutical processors licensed in the state of Virginia. Originally, there were 5, but one of the conditional permits was rescinded, and that is over here in this health service area right here, health service area 1. So this is available for applications to be submitted again through December 4th right now. But these other 4 are under construction or nearly operational. Way out here in Bristol, we'll have Dharma Pharmaceuticals, and they should be opening in just a few days. We have here in the Richmond area where I am, we have G-Leaf, and they are hoping to open by the end of this month. After that, we have Columbia Care out here in Portsmouth. And then we have Beyond Hello up in Manassas, and those will be the next 2 to open. And everyone is hoping to open by the end of this year. This one out here in Health Service Area 1, though, we won't see that license issued until March of next year. So this year, our legislation did allow for cannabis dispensing facilities. And look at that right there. You know, in 2016, we had to call the big vertical operations pharmaceutical processors. Fast forward a few years, and now we're calling the retail facilities cannabis dispensing facilities. So we're getting closer to that real world language that people use when they talk about this program. So the way the program is structured right now, we could have up to 30 in the entire state once Health Service Area 1 is licensed as well. Even at 30, that is an insanely low number to serve the entirety of Virginia. So we will definitely see continued expansion and improvement of this program, because I know no one wants to drive 4, 5, 6 hours to get to a dispensary. And you can see down here in this photo, this is Dharma Pharmaceuticals waiting room. So patients have to register for this program. This is something that's pretty common with medical cannabis programs in the United States. Here in Virginia, it's no different. So the first step is to get the written certification by a registered practitioner. Fortunately, you probably never thought you were going to say this. Fortunately, because of COVID-19, we have telehealth in place, and telehealth provisions are allowed that were not previously allowed. So, on a larger scale, and that is benefiting this program as well. So if you're at home right now and you want to get get certified by a practitioner, you can do that without ever leaving your house. You can click and schedule your appointment online and then complete your telehealth appointment. Once you are in receipt of your written certification, then you can register through the Department of Health Professions. That's who issues the medical cannabis cards here in Virginia. And it is a $50 annual registration fee for the patient. Now, the process is pretty quick. Board of Pharmacy is under Department of Health Professions, and they're actually issuing these written certifications. And it comes in one of those, tear the edges off and slide your hand in carefully envelopes, I guess is what you call it. It's not a plastic card with your picture on it. It's a piece of paper, and it has the blue security seal printed on it, just like anything else you get from the government. So that comes in your mailbox, and it's a pretty fast process right now. So, oh, I do see a question right here from Gabrielle. Can any practitioner issue a certificate? Any registered practitioner can. And that means an MD, a DO, a nurse practitioner, or a physician assistant who's licensed to practice medicine in the state of Virginia. That is who is allowed to apply to DHP to become a registered practitioner. And it's the same process for practitioners as it is for patients. They use the same portal, the Department of Health Professions, and they pay their $50 annual registration fee. And they get their certificate by email, I believe. So that was a great question and the perfect segue into that next slide.
Michelle, actually, we have another question asking about after all the paperwork is done and you're going to get the medicine, the medical cannabis. Are folks taking appointments for that? Is that all handled? How is that all handled? That process?
We're about to find out.
Excellent, thank you.
So. Patients are able to pre-register right now with the dispensaries, specifically with Dharma and with G-Leaf. They are the furthest along in the process, and they are pre-registering patients. There's a bit of patient counseling that has to be done regarding storage and disposal of the products, and so that's what you're going to get in these early consults from the dispensaries. If you do pre-register, we'll find out very soon, what the process is like once Dharma opens its doors to the public. I don't believe that either of them are doing appointments at this point in time. But if you want to expedite your visit, it is really important that you do pre-register and get all of that information uploaded into their system, because they will need to verify a patient's identity, and that's done with state-issued identification. Verify the patient is in fact registered and it is current, and that's done with the medical cannabis card issued by the state. And they will have to ensure that the patient's written certification issued by the registered practitioner is also valid. So you have the opportunity to upload all of those documents when you pre-register with Dharma or with G-Leaf right now. And you can find the links to all of the dispensaries on the Virginia NORML website at VA NORML, that's VANORML.org/dispensaries. All right, so registered agent is how we address individuals who might be minors or incapacitated adults, or even just an adult who can't physically go to the dispensary or even answer their door for delivery. The process is a little different for each. For a patient, I mean, for a parent or a legal guardian, they have to be issued a certification by a registered practitioner as well, and then also complete the registration process. The registered agent, that is someone, you know, for example, if I were to do this for my parents, I don't have legal authority over my parents, but I could serve as a registered agent. The patient has to appoint a registered agent who then registers through the Department of Health Professions as well and gets their registered agent certificate. And it's $25 registration for registered agents now. So that's how we are currently addressing patients who can't physically or are not legally able to go in and obtain medicine on their own. Now, school use. So what we did here is simply create a form that will accompany the medicine to school. Other than that, it's treated just as any prescription or over-the-counter drug would be by that individual school. So any individual who's authorized by the school board to administer health services at school or school events could be authorized to administer medical cannabis product to the student. So this could be the school nurse, it could be the aide that goes to school with the student. And it just eliminates what was previously a required expulsion or suspension for possession of marijuana on school grounds. Now, we make it hopefully easy for you to find a practitioner on our website. You can head to our website up there in the top. We have the link right here, vanormal.org/doctors. This is a screenshot of our website, and when you go there, you will see up in the top the resources tab. If you click that little arrow, you click on find a practitioner, and you'll be on this page. There are a number of practitioners you'll see listed right there that you can click and schedule an appointment with, a telehealth appointment even, and then there's a complete spreadsheet of all the practitioners that are currently registered with the state, including any information we may have about them, such as a phone number or a website, email, and their specialties. Oh, Melanie has a question here. This is great news for Virginians. However, what is Dominion Energy's stance on the subject, seen as they're highly federally regulated? I don't know. We didn't ask Dominion Energy what they thought about a healthcare program intended to serve all Virginians. My suspicion is that your question is regarding employees, and that's a great question. There are no employment protections offered by Virginia's medical cannabis program. This is something that we will continue to explore legislatively, and I think that it's most likely that we will be able to advance employment protections for medical cannabis patients prior to more broad employment protection like we've seen passed in Nevada that prohibits, largely prohibits pre-employment drug screening for cannabis metabolites. EpiPen training is traumatic, so hopefully this training will be easier on the nerves. Hope so. So we also have a step-by-step guide on how to register. Most of the practitioners that are offering telehealth are able to walk patients through the registration process now, and that's made it really, really easy. But in the event that you don't have a practitioner walking you through the process, we do have a registration guide, just a step-by-step on how to navigate the web pages. It's really helpful to have the guide open in one window and then have the registration page open in another. please don't try to register for the program on your phone. It's just not really set up for that. And again, this is under the resources tab on how to register. And if you have any questions, you can just give us a call. We have an intern and a part-time staffer who answer our phones Monday through Friday, 9 to 6. You can send us an email, and they are very used to walking people through the registration process. I'm going to go ahead and stop sharing now, and then you can just see more of me. I see some more questions here. Excellent. Thanks, Jackie. You have a question. You were approved in March, but a lot of things have changed since then. Your card says you're approved for CBD and THCA. Do you need to see a doctor again to get THC products? That's a great question, Jackie, and no. It is the same. It's the same program. So we did change the name of the program this year. Previously, it was products were defined as cannabidiol oil or THCA oil. And again, that just kind of harkens back to 2015 when legislature wasn't quite there, and they were calling things really names that you know, kind of gave them this emotional comfort with the fact that it was marijuana. So no, we did change the name of the program to cannabis oil this year. You can expect we'll change it again next year, and your card is the same. You'll probably get a new card issued at some point, but it's, when we changed it in the code, it magically changes on your card too. Becky, that's a great question. Are we getting any pushback from the hemp growers? I mean, I don't think we're getting pushback, but they would very much like to participate in this program as well. And we did pass legislation this year that allows hemp cultivators, industrial hemp licensees in the state of Virginia to sell CBD that has been extracted from their industrial hemp plants to the pharmaceutical processors at the wholesale level, as long as it meets the same testing standards, the same strict standards that we have in place for our medical cannabis plants. Oh, that's a great question, Nick. Can medical patients cultivate their own plants at home? No, only licensed, pharmaceutical processors can cultivate medical cannabis plants in the state of Virginia right now. So,
Jenn Michelle, I was interested in the fact that you're working towards it getting into schools for the kids who could benefit, because that, I imagine that's a major hurdle. I mean, kids have had trouble with EpiPens and insulin and things like that. I can imagine that this might cause some problems for some school boards or parents even, potentially.
Yeah, it might, and it definitely has. We heard from parents during the legislative process who couldn't send his son's CBD oil to school with him and would have to go to school, pick him up, and drive him 1,000 feet away from the school to administer his CBD oil, which they were using for seizure control.
Wow.
And very often patients who are using cannabis products for seizure control are often taking other medicines, and they have to be timed very specifically so that there aren't interactions. And that was the case with his son. And, ultimately we were victorious in the legislative process, and now that is law.
Yeah, that's just amazing. Obviously, it would be helpful for folks who have that prescription. So that's great.
Yeah. Kirsta, thank you for your question. Can I explain what the CBD is that you can get at gas stations and health food stores right now? Yes. So most simply, I can explain it as, I have no idea. I don't know what's in that bottle. Do you? It's not regulated by anyone. So you might find a product out there that's really great and it really helps you, and that's awesome. But It is very much a buyer beware marketplace because these products are not federally regulated. They are not FDA approved. And unless it is coming specifically from an industrial hemp processor licensed by the state of Virginia to produce hemp extracts intended for human consumption, there are absolutely no safety standards in place. There's no regulatory oversight. So it's just a, buyer beware marketplace. And unfortunately, we are seeing study after study after study, after review after review after review, including those done by DCU, those done by the FDA, that are finding time and time again that what's on the label is not what's in the bottle. So fortunately, you'll be able to buy products, CBD products included, at our medical cannabis providers that do have to accurately label and lab test. Hi, Ellie. When do we need to reapply? Do they send us a reminder? Yes, they will send you a reminder about a month before your card expires. Do we need recertification or just a new card? It depends on if your existing certification is still valid. This certificate, the written certification issued by the practitioner, is valid for 1 year. So that is what you need to apply for your card in the state of Virginia. So if your certification is still valid, you can use it to apply for your card. If it's not, then you need to get a new certification. Most people are going to have these, generally at about the same time, but for a variety of reasons, they might not be in sync with each other. You're also going to have a valid certification when you go to the dispensaries. So it's really important that you keep both your patient card and your certification up to valid. Ellie, you're so funny. Nick, how close is Virginia to regulating CBD products? You own a CBD store in Mechanicsville, and we have to regulate everything yourself. I'm so glad to hear that you're doing that, Nick. That is not the norm. I know a store here in this area, Richmond area, that's doing the same thing, and that is sending every product they get out for third-party testing so that they can be sure that what's on the label is, what's in the package. So the regulations specific to CBD, Nick, at this point are most likely only going to be able to be applied to those licensed by VDACs for industrial hemp. There is no regulatory agency at this point that has authority over stores that sell products from out of state, unless the store is also selling food, and then it would fall under VDACs in that regard. But they don't really have the bandwidth to send food inspectors in on CBD products. So it's interesting how that process is going. We'll see. Great question. I encourage you to participate in the legislative process. Cherie asks, when can Virginia be expected to decriminalize and legalize cannabis medically or for adult use? So this year, Virginia decriminalized personal possession of up to 1 ounce of marijuana. That took effect on July 1. So personal possession, that means it's presumed that possession of up to 1 ounce is for personal use, not for commercial sale. That is decriminalized to no more than a $25 civil fine. There is no criminal record. There is no record at all associated with the $25 civil penalty, unless you are a commercial driver's license holder, in which case the $25 fine is reported to DMV as is required by federal law. Now, medical cannabis is legal under state law. Also, we did both in one legislative session, which is largely unheard of. We did those, both took effect on July 1st. So medical cannabis is legal, both to participate in the program as a patient and for the companies that are cultivating and dispensing as well. So I'm sure that's a relief for everyone. And decriminalization as well is in place for those people who are not registered patients. Now, as far as adult use goes, the 2021 General Assembly will be the first real opportunity Virginia has had to legalize the responsible use of marijuana by adults. And the reason why I say the first real opportunity is this, because Virginia does not take big policy steps forward without first conducting a study. We called for that study in the decriminalization legislation, and this study has been completed by JLARC, the Joint Legislative Audit and Review Commission, and that report will be presented, I believe, on November 16th. So we'll see what JLARC's findings were. And now this isn't a study about should Virginia legalize adult use. It has very specific parameters set to explore how Virginia might best go about not only legalizing and regulating adult use, but undoing the damages of prohibition, because we'd like to have comprehensive legislation passed that includes not only the legalization code, but also the regulatory structure and some code that can begin automating expungement and ensuring that participation in any new industry that's created is equitable. So JLARC has completed the study, and we very much belt and suspended this approach. We also had a joint resolution passed that convened a legislative work group, and it is called the Virginia Marijuana Legalization Work Group. You can find that on the governor's website. You can find a link to it on the Virginia NORML website as well. I am appointed to this legislative work group, and our report is due to coincide with the final JLARC report date as well. All of those meetings are open to the public. If you are on the governor's website for the Virginia Marijuana Legalization Work Group, down in the bottom left-hand corner is a little tiny blue words that say meeting information. So if you click on that, you can see how to register to watch and offer public comment in any of the work group meetings or the subgroup meetings as well. Now, we'll have both of these reports in time to put together comprehensive legislation for the 2021 session. That's what we're looking at. And if this is something that you prioritize, I encourage you to send an email to your state senator and state delegate right now. You can do that on the Virginia NORML website under the Take Action tab. It's right there. It's super easy and takes just a few seconds to click and send an email to your senator and delegate letting them know that you prioritize this issue.
Jenn Michelle, we have another question through Q&A. Do we need to get any information from our regular current doctors to provide proof of conditions before we set up a telehealth appointment with one of the registered docs on Virginia NORML?
Yes, that can be extremely helpful and is required by some of the practitioners. So that's an excellent question. I do see the Q&A now. Thank you for pointing that out.
Sure.
Phyllis, I definitely recommend bringing any additional documentation you may have. I see Ellie's questions as well. How will this work with COVID? Will they take appointments? There will be social distancing requirements in place at the dispensaries, of course, Ellie, and they may begin to take appointments, but I think we're just going to have to get through that first opening and see how it goes.
I have a question about, you mentioned registration is difficult on the internet on your phone. Is that something that you all control, or is that a state website issue?
That is a state website. It is the Department of Health Professions, which is part of the Virginia Department of Health.
Right. So yeah, that can really pose an access issue as well, because there's a really high percentage of folks, particularly I think who are lower income, who use their phone as their primary source of internet.
Yeah, absolutely. And if you are having issues with that, you're welcome to give us a call or an email, and we can direct you to Board of Pharmacy to better assist you with that process.
Great. Thank you.
Mm-hmm.
Do we have any more questions for Jenn Michelle? All right. Well, thank you all for joining us. Jenn Michelle, thank you so much for participating in this webinar with us. We really appreciate your time, and we enjoy working with you. And this will be, this webinar is being recorded, and over the next few days, we'll get it put on our website so that if anyone missed any part of the presentation and would like to go back, please check for that recording over the next few days.
Thanks so much for having me.
Thank you all.